I was born and raised in West Monroe, Louisiana. I have 2 older sisters, both of them live in West Monroe, and I also have a twin brother. We're 10 minutes apart. I've been working for UPS for almost 14 years.
He's a quiet guy. Unless you know him, then he shows more of his personality, and he surprisingly has a very funny personality, very helpful, very respectful. He's genuinely a great guy.
I just woke up like a normal day, headed to work.
When he was on the way to work, he noticed that I'd called me. I was asking what I was calling for. And then 2 minutes after that, the first 911 call went through that he had gotten in the wreck. It would be 2 hours after that whenever we found out. His mom called me at 10:58 and asked if I was sitting down and said, "We don't know what happened, but Jared's been in a wreck and he's being airlifted to LSU."
Steve was outside doing something in the yard, and he came in and said our daughter Jennifer had called, and Jared had been in a horrible wreck.
On that particular day, they had called out for a 2-vehicle MVA that a truck had rear-ended an 18-wheeler. They had advised that Shreveport Fire Department, which is another town that's right outside of Ruston, was responding with us. We observed a truck that had hit an 18-wheeler, the backside of it. It was pretty heavy damage to the truck. We saw a bunch of bystanders around and a few other vehicles that had stopped to help because they had seen a major incident go down. Shreveport Fire, as I said a while ago, they responded with us. They came on the radio and came on our channel and advised us that there was another incident that happened that almost hit their fire truck.
Couldn't get over here because the traffic was backed up on the interstate. I think it's still from his wreck, and there was another one about the same time his. So it took us forever to get over here.
I didn't believe it whenever I hung up the phone. I called his phone twice because I didn't think it was true. But I had to keep telling myself, like, you have to be calm. You know, you're 6.5 months pregnant. You can't stress the baby out.
Cannot describe the feeling of knowing your child is, may not make it.
Jared himself was still inside the truck whenever we arrived on scene. But we approached him, tapped him, and tried to get him to say something. He would never say anything. And so at that point, we did a painful stimuli, which is either sternum rub or we squeeze the shoulder or something like that, trying to get him to respond a little bit. And he picked his head up and turned to us and wasn't really focused on anything, just you could tell that something was going on with him anyway. We did notice that he had a bone protruding from his arm, from above his elbow. Dispatch advised us that the helicopter had accepted the flight and was able to come to the scene. So we went ahead and requested him, mainly because we knew he had altered mental status, and just the mechanism of injury by itself kind of indicated to us that he definitely needed to go to a trauma facility.
Before a patient arrives in the ED, and specifically Mr. Jones, there's a lot of communication between the ambulance, the EMTs, the pre-hospital people that take care of Jared, and they told us that he was in extremis, that his blood pressure was low, that he had a fast heart rate, that he was having a difficult time breathing. So we had an idea of what tier to place him in, and he was a tier 1 trauma, which means that he had potentially life-changing and life-threatening injuries. So once he got here, he was directly transported to the surgical intensive care unit where Dr. Sammer saw him along with the trauma team. Fluids were initiated, blood was drawn, specific tests were done, which included an ultrasound, an electrocardiogram, a chest x-ray, and a CT scan.
When we got to LSU, we found out he was in heart surgery. And we didn't realize it was that bad.
He had several injuries, mostly to his chest and his extremities. One of the scans that showed some potential fluid around his heart was substantiated by a CT scan, which showed a fair amount of fluid around his heart.
Cardiac tamponade is when there is blood or fluid around the heart that prevents the heart from being able to pump and function appropriately.
The fluid around his heart was an emergent problem, and we were going to have to take him back to the operating room. We prepared his chest and basically performed a median sternotomy, where an incision is made through the breastbone to examine the injured structure. And indeed, there was a huge amount of clotted blood around his heart, and his heart was not functioning appropriately. And after evacuating the clot, we found a tear near his inferior vena cava where it attached to his right atrium. His heart was detached from the vessels that fed it. We basically took a Prolene suture, which looks like fishing line, on a needle, and ran a suture line along the tear where the inferior vena cava attached to the right atrium. And we carefully did that in a 2-layer fashion. We tested it. We allowed the blood pressure to come up to make sure that there weren't going to be any leaks. And then he did have some coagulopathy, which means he was bleeding from the raw surfaces, which we corrected with some blood products, which is available because we're a level 1 trauma center. He also had several other injuries, including crushing injuries to both sides of his chest with rib fractures and some what we call contusions of the lungs. He had a fracture of his right femur, in addition to potentially bleeding in his intra-abdominal cavity.
He'd been wanting to have a child for the longest time. Like, this was what he wanted. He wanted to have a child, and I just couldn't imagine the fact that I'm finally giving him this child that he wanted, and he might not be here to be able to experience that. And I knew that would be a shame for her not to get to meet him. That would have been horrible.
When Dr. White got out of surgery, we had him come out and talk with us.
They hear about a quarter of what you say because they're so concerned about the outcome.
I don't remember one word he said about it.
He just said that he was a very lucky man. That if it had been 15 minutes later getting over here, he wouldn't have made it.
Our level 1 trauma team really came into light at this time because without the appropriate transport, without the appropriate resuscitation, and definitely without the appropriate recognition of the injury, this would have been a fatality. And if you look at these blunt cardiac injuries, about 80% never make it to the emergency department. Of the 20% that do make it to the emergency department, most of the time they're not recognized. So I think our level 1 trauma team really paid off for this young man had he been transported to an area that didn't have the entire team on board early on, and I think it would have been a bad outcome for Mr. Jones.
The first thing I remember was waking up in the hospital with my family standing around me. I had asked them what happened, and they had just told me I've been in a bad accident and that I've been in the hospital for 3 weeks.
Told me better not ever scare me like that again.
They were driving back and forth every day to come see me, and knew how much they loved me. Even whenever I was asleep, they'd come over here and see me, and I wouldn't even know it.
That was an incredible day. Like, I knew that. Like, I just knew everything was going to be better after that. I could see it, and I could see life in his eyes. It was, just no matter what the troubles were we were going to have to face after that, or how hard it was to, get him back to being full Jared, it didn't matter because I knew he was going to make it. It was an incredible feeling.
It was a very happy day for us to listen to him talk.
They cried together, they prayed together, they did the things that families do together, and were obviously very concerned about his outcome. But when they saw the little bit of improvement that we experienced every day, they knew that the outcome in great probability was going to be good.
They were telling me that I wouldn't be able to walk for about 3 months, and told me I had restrictions because of my heart surgery.
Once he woke up, he was determined.
First started physical therapy on my elbow, and I did it for about a month before I could do it on my leg. And then I was going 3 days a week. Then once I got to do it on my leg, I would go up there and do my arm, physical therapy on my arm for about an hour, and then I spent another hour doing it on my leg. I did that for about 2 months, I believe.
Once he was able to put weight on that leg, he was up and going.
The 2 days before she was born, they had admitted me to the hospital, and he was there every second. You could tell he was just beyond happy to be able to be there to witness everything. And he just lit up. I've never seen that look on somebody's face before, but he was so, so happy. It was incredible. in any situation, seeing a father and the love he has for his daughter is going to be great, but knowing everything that he had gone through to be able to get to this moment just made it 10 times better.
What a great story for him to be able to get through this and have this present at the end of his hospitalization.
I could give Dr. White anything I got. He saved my son's life, you know.
If you have anyone that has any type of problem, you need to come to LSU.
We are the best chance of a patient's survival because we are able to address and care for any type of need that may come our way.
Thank you for saving my baby's father. Thank you for letting me be able to see that and be able to grow up with her. And it means more to me than I can ever put into words.
My life was definitely saved over here, 100%.